Schizophrenia is a psychological disorder that affects how one acts, thinks, and sees the world around them. Schizophrenics see and hear what others do not and find it almost impossible to believe that these voices and visions lie within their imagination. Sometimes these imaginings become so intertwined that the person cannot distinguish between them and reality.
One rare form of this disorder is childhood schizophrenia. This is a mental disorder which includes symptoms of hallucinations, delusions, disordered thinking, and behaviors that impair everyday life. These symptoms could easily be mistaken for other illnesses such as autism or muscular dystrophy. But more symptoms of schizophrenia will appear later on during adolescence. The most common symptom of childhood schizophrenia is unorganized thoughts, making it difficult to speak sentences correctly or speak according to the topic being discussed. Another more common form of schizophrenia is paranoid schizophrenia. This disorder forces a person to constantly feel unreasonably suspicious of others, making it hard to hold a job, run errands, have friendships, and even go to the doctor. These delusions reflect fear and anxiety, along with the loss of ability to tell the difference between reality and fantasies. Patients may also experience hallucinations, which typically involves a voice telling them to do harmful things or teasing them.
Although these disorders may seem very similar, they each have attributes that set them apart. Paranoid schizophrenia is characterized by its most prominent symptom of auditory hallucinations and paranoid delusions. Childhood schizophrenia is typically diagnosed when a patient is young, and disorganized schizophrenia is linked with symptoms of reality distortion and a lack of speech. These simple distinctions help medical professionals correctly diagnose their patients, but oftentimes there are other disorders such as substance-related disorders, anxiety disorders, OCD, and panic disorders that occur simultaneously with schizophrenia. When diagnosing schizophrenia, there are people who are more at risk than others, such as people with a family history, increased immune activation system, have an older aged father, had pregnancy complications, or used mind-altering drugs during their teenage years. Some may be genetically predisposed to these disorders, but it can also be triggered through environmental factors such as life events, interactions in a social environment, abuse, neglect, trauma, and an unhealthy communication with parents can all contribute to someone developing this disorder.
Schizophrenia is a rare disease where only about 1 in 285 people in the world are diagnosed each year. In 2011 alone, 21 million people worldwide were living with this disorder, and about 2.2 million are living in the United States. Gender does not affect the likelihood of one having this disorder, but it does affect the experience. Males are more likely to experience symptoms longer, and females exhibit mood symptoms and brief silent exploits.
Although this disease is mentally and physically crippling, there are treatments to help reduce symptoms. Doctors can use treatments such as antipsychotic, cognitive behavior therapy, and rehabilitation programs, which can greatly reduce the distress of schizophrenia. If you or a loved one are experiencing any signs or symptoms of schizophrenia, don't hesitate to reach out to a doctor for help. You are not alone.